So now we're going to move on to the Health and Medical Research Office based in Canberra with Natasha Ploenges and Dr Ragini Singh, who are the Chief Executive and Director of Policy and Support, respectively, of that department. And amongst other things, they're responsible for implementing the $20 billion Medical Research Future Fund and the $500 million Biomedical Translation Fund. So over to you, Natasha and Ragini.
Good afternoon, everyone. So I would like to start by introducing myself. I'm Natasha Ploenges. I'm the Chief Executive Officer of the Health and Medical Research Office, which is in the Australian Government Department of Health and Aged Care. Today, I'm joined by Dr Ragini Singh, who is the Director of the Policy and Support team for the MRFF, and I will flag now that we will regularly refer to MRFF instead of the Medical Research Future Fund. So you might have to bear with us as we refer to it that way. Thank you very much for inviting us along, and I would very much like to start by acknowledging the traditional owners and custodians on the lands in which we are meeting today. For both Ragini and myself, we are joining from Ngunnawal and Ngambri lands, which is in the Canberra region. But I do want to also acknowledge, of course, that we are across country and meeting with people on many lands. We also pay our respects to the elders past and present and emerging, and also pay our respects to all Aboriginal and Torres Strait Islander people who are part of this symposium today as well. There'll be a range of items that Ragini and I will go through. So some of this we had felt was probably helpful to, in some ways, take it from the top when it comes to the Medical Research Future Fund and really provide some of that background to you. So we will talk about some of the key features, such as supporting research translation, the changes that have been made, have been made over time, and how we can also keep connected. Ragini will also then speak about some of the very specific Medical Research Future Fund missions and initiatives that we think will be of particular interest to members of the symposium today. If there's an opportunity, of course, for questions, we're happy to do that, but we know that we do have the panel session at the end, which can provide that opportunity. Thank you very much. The Medical Research Future Fund was established back in August 2015. So it has been going for, certainly for the Act, has been going for quite some time now. The MRFF itself disperses $650 million in research grants per annum. And there is $6.3 billion has been committed under the Medical Research Future Fund under its current 10-year investment plan. And that sort of 10-year investment plan covers from 2022-23 financial year to 2031-32 financial year. The funding is provided under 21 initiatives, and that is supporting a range of things, which covers life-saving research, job creation, it supports local industry, and in particular it also supports Australia's reputation as a world leader in medical research. The $20 billion capital investment that funds the Medical Research Future Fund itself came from the sector, and that was really generated through health system savings, and that's where that body of $20 billion has been provided and is now being, as I said, dispersed annually at $650 million per annum. Now, next, thank you. So this slide really just provides a bit of a sense of some of those key background legislation and key documents. We will go, certainly I think it's pretty much our last slide, we'll provide some further information for you about links and things like that, which will be important for you to be able to see if you're interested in following. But this really takes you through and gives you a nice high-level view of the governance and structural arrangements for the MRFF. So, as I'd said, it had been established under the Medical Research Future Fund Act in 2015. There is also an independent Australian Medical Research Advisory Board, and because I've been a member of the public service for so long, I do like to use an acronym on occasions, so we do refer to that board as AMRAB. I will try and use the full title when we're speaking throughout this afternoon. But that board helps to actually determines the Australian Medical Research and Innovation Strategy and the Australian Medical Research and Innovation Priorities. So it really helps set the scene and drives where we go and what are the priorities for the Medical Research Future Fund. The 10-year investment plans in particular are the mechanism that we use for implementing the strategy itself and the related priorities, and those will continue to evolve and address emerging health challenges and respond to those sort of evolving guiding documents as well. As I'd mentioned, we are currently operating under a particular 10-year investment plan, which sets out the Australian government's plans for the use of the MRFF funding itself by identifying the levels of financial support from the MRFF for those initiatives to be funded over that period of time that I have referred to earlier, so which is from 2022-23 to 2031-32. All of those initiatives themselves that are funded under that 10-year plan are indeed subject to evaluation, and we have heard from previous speakers, of course, about the importance of learning and undertaking that evaluation and feeding that back into the processes. So I can confirm indeed that all of those initiatives under that 10-year plan are subject to evaluation. And the framework for evaluation is set by the MRFF Monitoring, Evaluation and Learning Strategy, and that is about to assess the impact of the MRFF itself. So some of the key features of the MRFF include it being flexible and responsive, and able to respond to emerging issues. And I think a fine example of that under the MRFF was how the research priorities and how the fund itself was able to respond quickly to the COVID-19 pandemic, and had invested just shy of $140 million in research grants that were focused on COVID-19 specifically. One of the other key features of the MRFF is that it is priority-led. So that means that the investments themselves are priority-driven, with those priorities renewed every 2 years, and that's determined by the Australian Medical Research Advisory Board, or AMRAB, as I had referred to earlier. And each of those priorities contributes to the key elements across one or more of the strategic objectives to achieve health equity and to deliver health outcomes, as well as, of course, economic benefits through that sort of transformative and innovative research. It is also outcomes focused and collaborative. So when we talk about that, it is about saying that the MRFF itself really is intended and does bring together consumers, stakeholders, industry, researchers, and other partners to be able to deliver those key outcomes. We also talk about innovation in this space, and we are really seeking to continuously improve the way that we fund grants, and we have been trying to utilise, or have been utilising, new grant models, such as MRFF incubator grants that support early stage or short-term research projects, and the MRFF accelerator grants that support large-scale multidisciplinary research to drive that sort of implementation and translation piece. One of the other distinguishing factors of the MRFF that we certainly think sets it apart from perhaps other grants as well is that it's assessed by an independent grants assessment committees, or its committees being plural, and it's not a standard peer review process. So the members of those grant assessment committees are expert reviewers who come from different backgrounds and bring, of course, a range of perspectives to that assessment process. So those members are selected on their experience and their expertise in a range of areas, such as, unsurprisingly, academia, clinical, health service delivery, translation of research, consumers and patients, Aboriginal and Torres Strait Islander health and Aboriginal and Torres Strait Islander people, and industry and commercialisation expertise as well. I will now pass on to Ragini, who will take you through the missions and the initiatives as part of that translation piece.
Thank you, Natasha. Next slide, please, Gina. So within the Australian system, we have two main complementary government streams for health and medical research funding. And this graphic really reflects sort of where those two main funding sources sit. So the National Health and Medical Research Council primarily funds investigator-led research, focusing on really building that foundational capacity and capability. And it's complemented by the Medical Research Future Fund that funds priority-driven research, complementing investigator-driven research. We also have the Biomedical Translation Fund, which provides companies with venture capital through licensed private sector fund managers. And of course, the private sector that funds sort of the market end of this continuum. Next slide, please. So under the current 10-year investment plan, as Natasha mentioned, we have 21 initiatives across 4 themes. And you'll see research translation is one of the prominent themes. These themes fund research from preclinical areas, but more so towards the translational end and implementation research. Under the patients theme, we really aim to bring benefit to patients, including bringing life-changing clinical trials, funding treatments, and advanced healthcare and medical technologies. Through the researchers theme, we aim to support Australian researchers to support their skills in capacity building and to help bring new research discoveries to market. Research missions are our really large programs of work that bring key researchers, healthcare professionals, and stakeholders together to tackle large health challenges being faced by the sector. And finally, the research translation theme aims to translate research outcomes and bring them into practice by building that evidence base. It also aims to support the adoption of best practice care into healthcare delivery. Next slide, please. So in relation to how our initiatives link in with the priorities Natasha mentioned, we have 13 priorities that span 21 initiatives. And one of the priorities is translation and commercialization, which is linked to 8 of our initiatives specifically. However, broadly, all MRFF grant opportunities encourage partnerships. They try to bring together industry, companies, organizations, consumers, researchers to answer those big questions and to help translate those research findings into practice. Next slide, please. The MRFF currently has 8 missions, and each of our missions are supported by roadmaps and implementation plans. These are developed by independent experts and then through national consultation are finalized and then utilized to dictate essentially how we develop our grant opportunities under each of the missions. So one of the missions, of course, is the Dementia, Aging and Aged Care mission. And this mission, we've committed 122.5 million under the current 10-year plan. This mission aims to improve the outcomes for people living with dementia, in particular older Australians, and it aims to help with the detection, prevention, and treatment options for those people living with dementia. It also aims to really improve access to quality of care and help older Australians live independently for longer. We do have a grant opportunity currently open for applications till the 7th of August of this year. So if you're interested, you can find further information on the government's Grant Connect webpage. We also have the Indigenous Health Research Fund mission that aims to support Indigenous-led research to tackle health issues being experienced by Aboriginal and Torres Strait Islander people. And through this mission, we really focused on funding Indigenous-led research practice and also Indigenous-led governance. It's focused on knowledge translation and evidence-based change in health practice. And we really want this mission to build on the unique and existing strengths of our communities, and particularly reference those strengths and reference the culture and spirituality. We also have a grant opportunity currently open that's closing on the 24th of July. Next slide, please. In addition, we've got initiatives under the researchers theme that also focus on knowledge translation. The Clinician Researchers Initiative is an interesting one, where historically it was used to top up NHMRC's fellowship grant opportunities. But in the last few cycles, we really tried to empower groups of clinicians to come up with projects in their area of expertise and identify those issues and also solutions to those issues. These grants have really supported GPs, specialists, and allied health researchers, as well as bringing together clusters of various expertise to tackle some of those implementation issues and to implement evidence-based practice into healthcare. We will be forecasting future grant opportunities under this initiative as well. Next slide, please. Final one that I'd like to briefly mention is our Rapid Applied Research Translation Initiative. This falls under our translation theme. And these are really large-scale programs of work which aim to support transformative translational research so that patients can benefit from better quality of care. The RAD initiative was initially developed in response to the McKeon review that you'd be aware of, which had proposed a new strategy for health and medical research in Australia. And this initiative really looks at funding those large scale-up projects led by health services. We do have a grant opportunity currently forecast. I'll now hand back to Natasha to conclude the presentation.
Thanks very much, Ragini. Excellent. Thank you. That is just the slide I was wanting you to go to next. So I really do want to be able to talk about, and I am conscious of time and keeping us to time. I'm getting a nod as well saying, yes, thank you for that. So I'll just, in some ways, let the slide speak for itself, and it may be some things that we go to as part of the panel session. But I do want to highlight that certainly as part of some of the changes over time and we have that as the first dot point, is really about strengthening that focus on consumer involvement and those priority populations. So we are continuing to work towards increasing the involvement of priority populations. So that includes older people who are experiencing diseases of ageing and associated with ageing, through having culturally safe and appropriate engagement in our grant opportunities. We have, under the MRFF, we took the step of appointing a consumer reference panel as well, and that was in early 2022. And that panel provides advice on the strategies for strengthening consumer involvement as part of the MRFF funded research. And the panel had also helped review and refresh the criteria that's used for actually assessing applications for the MRFF. What we might do, if we can go to the next slide, please, as I'm conscious of timing. So there is a range of data that's available. So that includes, we publish the data, so you will indeed also be able to see some of these things for yourself in your own time. But it is published in reports that we have. An example of that is the MRFF Financial Assistance Report, which includes MRFF grant funded rates. We also have a report on gender data, which highlights for us that some of the overall MRFF funded rates for women and men are similar. And certainly that was an area that was particularly important for us in the MRFF. Happy to go to the next slide, which is about keeping connected. And this just helps to give you a sense of the ways that you can keep connected. As I had said, there is not only our website where you can find reports, but also you can subscribe to the MRFF news. You can also send questions to us. But as I said, a whole range of different links and other ways of connecting with us that's included there. So that will take us to the end of our presentation, and happy for any questions later on or connections made with us later on too. Thank you.
Thank you so much, Natasha and Ragini. That was very informative about how the MRFF works. We will have questions at the panel, okay?